Thank you for joining in today for this episode of The Advocate, a production of the American Society for Gastrointestinal Endoscopy that informs physicians and patients on emerging healthcare topics impacting GI. ASG represents over 14,000 gastroenterologists worldwide and is the leading voice for GI endoscopy.
Hey everybody, and welcome to ASGE The Advocate. I'm your host and ASGE President, Dr. Klaus Mergener. Today, we're going to talk about important issues related to diversity, equity, and inclusion, and ASGE's role in regards to that critically important topic. I'm very pleased to have with me as our guest today, Dr. Jennifer Christie. Dr. Christie is Professor of Medicine at Emory University. She is a counselor on the ASG Governing Board and the incoming Vice President of ASGE. And importantly, she's the chair of the Diversity and Inclusion Committee for ASGE. Jennifer, welcome.
Thank you, Klaus. Glad to be here.
So let's get right to it, Jennifer, and let me ask you to help us frame the issue a little bit and tell us about the current state of diversity and inclusion in gastroenterology.
Thank you, Klaus. We're currently in the process of collecting better data to understand where we are as it relates to diversity in gastroenterology. However, in 2017, the American Association of Medical Colleges who traditionally reports Latinx, Black or African American, Native American, as well as Alaskan Natives as underrepresented in medicine, to compromise about 33% of the U.S. population. However, they only constitute about 10% of GI faculty. Therefore, we certainly have a long way to go as far as diversifying our workforce. And as it relates to gender, we know that about 15% of all practicing gastroenterologists are women. We have improved as it relates to women in gastroenterology over the last few decades, and we are working towards improving women in leadership in their institutions as well as in their practices, and certainly in our GI professional societies. We're very intentional about making sure that our courses, our course directors, our committees and committee chairs, and also executive leadership really reflect the people that we serve. So we have improved, but certainly collectively we can get there and we have a ways to go.
Definitely still a long ways to go, and something that, thanks to you and your committee, as you point out, we've really emphasized quite a bit, especially in recent years. So switching to clinical care then, can you talk to us a little bit about reducing disparities in GI health and disease and where the main opportunities lie?
Yes, sure. So the first thing that I think about, Klaus, as it relates to disparities is in colon cancer. So we know that African American men have the highest incidence and mortality rates from colon cancer. However, underrepresented minorities, including African American men, have the lowest screening rates. Now, we want to improve our screening overall in our entire population, but it's particularly lower in underrepresented and underserved groups. And so we really have to push for policy and education around getting patients in to get their screening tests. And then making sure that that screening test, if it's a stool-based test, is followed up with a colonoscopy. And then also we have to make sure that we push forth policy that makes it easier for people to actually get treatment if they're diagnosed and improve outcomes in our underserved communities. So this is a key area in which we can impact.
No doubt. And I'm not sure our audience is aware of the actual numbers. For example, as you mentioned, the discrepancy in mortality rates. African Americans, I believe, have about a 40% higher mortality than
Absolutely.
Hispanic whites, and that is just quite striking.
Yeah.
So definitely an area, as you say, that we need to work on improving. Let me ask you how diversity and inclusion impact our GI patients.
So the first thing for this particular question that I think about is the pipeline. The fact that we have so few underrepresented minorities in gastroenterology, we know that this is going to impact patient outcomes. There's a lot of data out there that shows that ethnic minority healthcare providers are more likely to work in communities either from which they came or that look like them. And so, and we also know that patients tend to have better outcomes when treated by providers that they have a greater affinity for. And that may be because of better or different ways of communicating, which builds trust and compliance for our patients, as well as follow-up. And then certainly that's going to impact outcomes. And so if there are fewer providers to care for our underrepresented minorities, then our patient outcomes may not be optimal and as good as they can be. So I think we have to get more underrepresented minorities into medicine, into internal medicine, and then interested in gastroenterology. And I'm biased, certainly. And so I try to push that every opportunity that I can.
Definitely a great point. My next question is sort of a bit of a vision question. If we were to get there, what does that look like eventually? How does equity look like to you once we achieve it?
Yes.
What does it
So
mean?
a big smile, even the thought of that, it's a big smile that comes across my face, and I see it in yours too. But equity to me means that everyone, despite gender, race, ethnicity, sexual identity or sexual orientation, religious background, age, or disability, has the same access to financial, educational, and healthcare resources, and they're all intermingled. And so, there's a lot of undoing that we need to do that systemic racism has created in our society. And it sounds like, and it is a big undertaking, but every single one of us have to be a part of it to make it happen.
It sounds like such a fundamental truth, right? Such an obvious place we should be and need to get to, and it's so hard to take the individual steps. In terms of the hurdles and the challenges, what are some of the greatest challenges to advancing diversity initiatives, do you think?
Yeah, I think one of the greatest challenges that I see and on a daily basis is really getting everyone to understand how important these initiatives are, and that it helps all of us to be better. Not just folks that we are focusing on creating greater equity for, but all of us, and that everyone needs to be active and intentional about actualizing these initiatives. So it's really just getting everybody to play together and make things happen. And the other thing I see is apathy. Some people say, well, it doesn't impact me, I can't do anything. And so they just sort of sit on the sidelines. And again, if we can get everybody in the game, we can really start to win and make things happen.
Apathy definitely being a key issue on a personal base. My own mom, when we're talking gender diversity as an example, decided, this was back in Germany, but similar issues to some degree over there, decided not to continue with colorectal cancer screening because she insisted she would only be treated and examined by a woman. and there was no woman anywhere close to the area where she lived. And so for over a decade, with her son being a gastroenterologist, she was sitting there essentially not getting the care that she needed to get for the simple reason, not so simple, but for the obvious reason that she just wasn't comfortable there. So this is such a key issue for all of us. Jennifer, you've alluded to it already a little bit, but I want to ask you again about what ASGE is doing to advance diversity and inclusion initiatives.
Yeah, this is a very exciting time. One of the big things that I wanted to share is that we have developed an action plan, and this action plan was put together by many people, got involved and opined on this. But this plan is built on the premise that all committees, members, task force, executive leadership, and staff and members are committed to developing strategies in their space, wherever they're working or whatever they're charged to do, enhance diversity initiatives in what they're doing. And that's what the ASG family does. One example of that is that we also are rolling out a new research award that focuses on healthcare disparities and minority health. And we're working with the research committee to roll that out and make people aware of that and really start to support more of this work. We're also active in health equity policies. ASG has always been very strong on advocacy and pushing and supporting policies that advance the health of underserved communities and patients. We also plan to integrate a diversity statement in our publications. We have the ASG LEAD program that helps to advance women in gastroenterology, both in practice as well as in academia. We've been doing that since 2014, and that continues. And so there's a lot of really good work that we're all committed to bringing forth.
Excellent. Thank you for that overview. In terms of advocacy, just staying there for a moment, what are the potential impacts of advocacy on enhancing diversity, equity, and inclusion in GI?
So advocacy can be achieved on so many different levels. You know, when a while ago, when I heard advocacy and thought about advocacy, I said, you know, what can I do? I don't know anything about, you know, public policy, government, and, you know, but what I have learned over the years is that advocacy is oftentimes what we do every day, right? We participate in community programs to help advance or provide services to underserved communities. We vote, that's a big one. But on a group level, ASGE is all in. You know, we are very happy to be working with the Biden administration in placing issues of racial equity as it relates to health equity on the forefront of our discussions. We look forward to working with the administration to address issues around eliminating healthcare disparities in GI access and education. And we also know that with COVID-19, it really highlighted some of the inequities in care that we're seeing, and the fact that it has impacted underserved and poor communities even greater than the general population. And so in knowing that, and also as it relates to GI specifically, we're working really diligently to help to understand how systemic racism has impacted some of these policies, and then what we can do to reverse them or not allow it to continue to create such inequity. Next week, actually, many of us are participating in a virtual Hill visits where we're going to be requesting funding to be allocated to increase colorectal cancer screening in underrepresented communities. And so during the 117th Congress, we're going to advocate to promote such policies, and also to increase awareness in the value of preventive healthcare services, particularly as it relates to screening.
Right. So the folks who are watching us or listening to us, and really all physicians and patients, if they're interested, what can they do to express their thoughts on diversity, inclusion, and equity?
Yeah. So I think the first thing that we all have to continue to do is to have conversations about how these issues may affect our colleagues, our trainees, our staff, our patients, most importantly. And as we start to hear that, then and understand that, then we can actually move forth with actions to help improve it. So I think beginning to talk to one another about your experiences and how your experiences help you show up for each other, right? And how it has impacted where you are today. I think another big thing which we've talked about is advocacy. So you can write to your state representatives about an issue that you feel very strongly about. You can engage in opportunities, as I mentioned earlier, to meet with your state representatives on these various issues, both locally and federally. And I mentioned vote, vote for people and for policies that you think would help move issues as it relates to equity and inclusion forward. And then you can get involved in your local school programs, church, places of worship, have opportunities for you to engage. And then also engaging in peaceful protests is another way to express issues that are important to you. So there are many different things you could do locally as well as on a federal level.
Super. Well, this was great, Jennifer. I wanted to really thank you for making time today to talk to us about those, again, critically important issues. And I wonder if you have any final thoughts or comments for us.
Yeah, I guess what I would say to sum it up is that, again, because inequity and disparities affect all of us need to get in there to help reduce them. So thank you.
Thanks very much. And I want to once again, from the perspective of ASGE, reiterate what Dr. Christie said and voice our strong commitment to assuring equal access to GI services and screening services and to advance health equity and fight these disparities that we've been talking about. So thank you again, Jennifer, for making time. And I would be remiss if I didn't also thank all the physicians, advanced and care providers, and our staff for all the wonderful work that everyone is doing, especially during the COVID-19 pandemic. So from everybody at ASGE, thank you for watching, and we'll catch up with you again soon at a future episode of ASGE, The Advocate. Thank you.
Thank you.